Webinar. We offer these webinars on a monthly basis. We have some information about some upcoming webinars later on in the presentation. I'm going to first push the record button. This webinar will be recorded so that if you want to view it later and listen to it later, you can, or share it with others. You'll be receiving the link to that as well. Some housekeeping details. If you could place your phones on mute, that would be great. I'll mute all the phones if there's some background noise. As the webinar proceeds, if you have any questions, please feel free to use the chat function where you can put some questions as we proceed, and we'll be able to find out what your questions are. And as I said before, the webinar is going to be recorded so you can see all of the information we're going to be sharing a little bit later. A little bit about the Institute for Enterprise Excellence. We have been offering webinars roughly monthly for a while, primarily through the Theta Care Center for Healthcare Value when I was the network director at that time. We're continuing on with that practice to provide webinars for the general public. Anyone who wants to participate can. There's no cost for doing these, for participating in these webinars. And as I mentioned previously, and I'll be talking about later, if you have some information you would like to share as a presenter at one of our future webinars, please feel free to do that. We describe ourselves as pracademics, and what that means to us is that we think in terms of being right on that water line. If you imagine a iceberg and the things you can see on the surface, such as methods and tools, results, behaviors, those are the things that are readily evident. There's also things that are not evident that are underneath the surface. One of those is the theory behind that, the work that is being done. And it's our belief that theory alone by itself without application is waste, but also that practical applications, methods, tools, things like that, alone by themselves is also insufficient. So we're always trying to think about the balance between the practical application and the theory behind the practical application. So the topic of today's webinar is going to be a little bit about some of the research that we've been conducting and how we've been trying to apply that research and using that research. On this slide, you can see the various topics we're going to cover, which includes a little background on the model if you're not familiar with it, the original survey intent and design, how we designed it to be used, the actual survey instrument, the dimensions that are covered, some examples of initial application where we are trying to see, looking for differences or improvement over time, talking about what I'm calling the fifth element of the research, which is actual results, how we've used this survey instrument in actual assessments in conjunction with on-site behavior assessments, what we've learned about that, how it can be used to understand the current state in an organization, some of the lessons thus far, and if anyone on the webinar, either live or in listening to the recording, is interested in how to get involved, or if you have further questions about the research tool that we've been using, you'll have a chance to do that. Also some time for Q&A. I'll unmute the phones and we can talk about that. And then some time to talk about what are some of the future webinars that we're going to be having down the road, yet in 2016, but also planning for 2017 as well. So let's get into it. A little background on the model that we talk about in our courses is shown on this slide. The model on the left, we call it the sustainability model. It includes some of the information that you may be familiar with through the Shingo model, but we built on this. And so we're describing this in the courses that we teach, and some of the elements that we've added are at the top, understanding the purpose of an organization and how people can use and understand the purpose and the reason why people want to try to apply and learn guiding principles in the design of systems. In the middle of the diagram, we talk about what's the ultimate purpose of trying to apply this model, which has to do with trying to create a culture of continuous improvement, and also understanding the difference between culture and climate. We see climate as primarily that is set in place with senior leadership. They set the tone or the tenor for the organization. And climate, one of our definitions that we use is it's the sum of the behaviors by which people are achieving the results in an organization. And then finally, a little bit about environment and relationships on the bottom part of the model. We featured a little bit about this in last month's webinar that I'll be showing you where you can get that access to that recording a little bit later. But under environment and relationships, we had a great presentation from Dan Lent-Coop at the Sandoval Regional Medical Center in New Mexico on emotional contagion. So we talked about that last month. If you're interested in learning more about the sustainability model, you can go to that link at the bottom, the bit.ly link for our Foundations white paper. Another model we talk about, we call it the velocity model. And there's also some white papers related to each of those three dimensions: dimension of alignment, dimension of enabling, and dimension of improvement. So in the velocity model, we're talking about how an organization control, either accelerate or perhaps decelerate, or have an even balance on the velocity of their transformation model, and how they need to think about the three corners of this model as pedals to push evenly to try to produce the kind of velocity that they want. You can see some numbers in this model where it says 1, 2, 3, 4, and so on. When we are assessing organizations, we're looking at the maturity level of the systems that we see. And when we teach this model, we teach people how to self-assess, looking at level 1, level 2, level 3, and what that means. What we're going to be talking about in this webinar is a method that can be used in a supplemental way. It's not a substitute for an on-site assessment, but it is a way to understand current state of an organization, and we're going to be sharing a little bit about what we've learned about that. So I recommend, if you want to learn more about these models deeper, refer to those bit.ly links to go to those white papers where you can learn more about that. Another model that we've been talking about, and it is also explained in a little more detail, is shown on this slide, and that's our deployment model. We realize that there's not one way to deploy a continuous improvement or a lean philosophy into an organization, but in our work as pracademics working with organizations, we've come to realize that there are some methods that work and there are some methods that don't work. And one of the methods that we think has the strongest case for working is one that's described in this model. And one of the key features in this model is that the initial work needs to be led by top management. That's that middle swim lane there. And they need to spend time understanding the guiding principles, defining the ideal behaviors for themselves. They need to start practicing new behaviors, and they need to create new kinds of conversations. Once they've proceeded at a point in time along that individual journey, then they can start designing simple systems for themselves. And they can also start helping to lead the organization in design of systems. And that's the way we think about that model. So again, if you want to learn more about that part of the model, take a look at it at that white paper that you'll find at that bit.ly link below. And we're going to have more presentations on this model as the years proceed, as we learn more about how this model works. Another thing we talk about when we present the materials is the relationship between see, do, and get. And I just want to spend a little time explaining what we mean by that, because that's going to be an important part of understanding the survey instrument that we've been studying. So when we think about the see, there's actually two ways to understand the see. It's how we see, it's our mental models or our worldview, but it's also what we want to see as far as our vision for the organization. So when we're clear about how we see things, or we're clear about what we want to see, that will determine then the kinds of behaviors that we're going to exhibit, what we're going to do. And we talk about this in terms of key behavior indicators. those key behavior indicators, those behaviors determine then what you get, which relates to the results that almost everyone is interested in achieving in an organization, both the KPIs that are measurable as well as those that are unmeasurable. And those results then go back and inform, and you can adjust that those mental models you have, or you can adjust how you see that vision. So I've had people ask me, so what? So what does this mean? Why would you want to talk about the relationship between see, do, and get? Well, here's one of the important answers to that question. When you understand these new principles, these principles that are covered in those papers that I talked about earlier, and you start thinking about the ideal behaviors, those are the ideal behaviors that you can adjust today. You can assess where you're at today, and you can adjust those behaviors today, which will then lead to the KPIs, or the lagging indicators. So many people have misunderstood this concept to not really realize that if you do want better results, and certainly people are trying to get those better results, just focusing on the results alone is not going to do it. As a matter of fact, many of those results are going to be the lagging indicators of the work that you've done. You need to think about what are the leading indicators, or the key behavior indicators about what you're doing every day. I've got a few examples of what do we mean by key behavior indicators, and when we do work with organizations, we help them to define their ideal behaviors that they want to see, starting with what leaders would be doing. And here's an example of a definition, or a description of a key behavior indicator. What would you see leaders doing? What would you see managers doing? They would be listening and tracking ideas from the front line, as one example. And then what would you see the front line doing every day? And these are just a few examples of the kind of key behavior indicators that you want to develop in order to eventually get the kind of results you're trying to achieve, which are listed there that you can see on the slide. Now, I want to go back to this deployment model, or the swim lane model, and describe how are we applying this survey instrument that I'm going to be talking about in this. And some of the work that we've been doing is, when we work with organizations and help them to understand and apply this model, we initially get some baseline data using this simple survey that I'm going to be showing you in a little bit. And then we ask the organization to provide us with updated information, again by follow-up surveys, roughly in 6-month intervals, so that we can sample, say, 6 months, 12 months, 18 months, and then into the future we can understand how the organization is learning and applying. And essentially what we're tracking initially with this survey is movement along those key behavior indicators, or the KBIs. So I want to talk a little bit about the survey instrument that we put together. There are 4 dimensions. There's an alignment dimension, there's an enabling dimension, there's an improvement dimension, and there's a results dimension. And I'm going to illustrate this by talking about the alignment index first. So each one of those 4 indices has an overall question that we ask participants to rate in terms of how strongly they agree to a statement. And this one, the statement that they're providing information on is, our organization creates a sense of purpose that is simple and clear that I can connect to. So that's the very first question, call that the overall question. And this question in the alignment section is based upon these principles. And we're looking specifically at systems that help to produce the alignment. And what we're interested in knowing is what behaviors do we see, and what systems are driving those behaviors. So the first question that's asked in each dimension category is an overall question: how strongly do you agree? And then we follow up with a number of sub-questions, which are really getting after some of those principles, and specifically some of the systems that would help to drive those ideal behaviors. And we're asking participants to provide numbers from 0 to 10 along 2 attributes. One is how strongly they think they are, their current state, and how well it matches the ideal, and that would be the A category. And then we also want to know In what direction do you think you're going? In what direction are you heading? Closer to the ideal? That would be closer to 10. Or are you heading farther away from the ideal, closer to 0? In the methods that we've used thus far to administer this, we've had people simply provide the numbers that they see in the work category where they're at. Now, this is an important aspect. So when we ask leaders to provide data, we want to know how they're seeing how this is being applied in their work area. When we ask managers, we want to know how it's being applied in their work area. And we've also asked the front line, how is this being applied in your work area? We're not interested in how people think it's going across the broad organization. We want to know for the work area, primarily where they're involved, how is it that they see their current state? So this is one methodology where we've gathered data. We've also transferred this into a easy-to-use SurveyMonkey method. And using this methodology, we've learned that it's taken, on average, less than 5 minutes for people to provide data for the use of this survey. And then there's even simpler methods. I've used Postit Notes, for instance, where I've had people give responses to skip specific questions, give me that data immediately, and then we've been able to process the data accordingly. So there's a number of ways we've been using this to get the data to make it as simple as possible. And we know that in organizations, people can be using multiple surveys, and they're reluctant to take on yet another survey without understanding how it's going to benefit them. So we've tried to make this as simple as possible. I want to share a little bit about how we've used this in some of the initial applications. So here's an example from the alignment index, and it's some data from some leaders where they gave us some data on how they were viewing that overall question, which is over here on the left, and then the sub-questions related to alignment of goals, current state, and also which direction are we heading. That's why we see the A and the B. How everyone knows their role, again, A and B. How strongly is there a customer focus in the work that they're doing, A and B. The decision impact that it has on the customer, and then when decisions are made, are people considering a broad impact on those questions? Some of the ways that we've used this is we've identified what the current state is on that main question over on the left. We've also identified where there seems to be some of the strongest systems, for instance here related to customer focus, or where there seem to be the biggest gaps, and primarily in the A category you can see here. We've also used it to show variation in the respondents. Now, some people, we have one person here that gave a rating of low in a number of attributes, and sometimes it's important to know that these lower numbers are coming from one person. We don't assign a name to that, and it's all confidential. But it's important to know that somebody's having a different experience related to these results. Here's another example. This is in the improved category. Now, in the improved dimension, we're asking a lot more questions, and that's why we have a lot more of those A's and B's underneath there related to this. One of the things that's interesting about this is this was administered to a team that was wanting to know their current state related to their improvement systems. And the person that is circled there, you can see that that person was giving lower ratings on those systems. And one of the things that I knew about this respondent is this is a person who is pretty well steeped and pretty experienced in doing assessments. And I think this is an important thing to keep in mind as you're applying this instrument if you're interested. Not everyone has the same lens through which they're answering these questions. So some people, without knowing what a really good system looks like, may say that they think that they're at a level 10. A person who has seen some really good systems, that has seen some really good and robust, call it lean systems or daily management systems or improvement systems, could perhaps be a little more have more scrutiny to what they're seeing with their own system. And that was the case in this situation. There was an experienced person that was part of the team, and it wasn't that they saw necessarily that bad things were happening in their team, but they were a little more careful and also had a different lens through which they were looking at the data. So as we use this with organizations, it's important to have conversations with the people about the data that they're seeing. Now here's one of the uses of the instrument. We want to know, and as I said before, in roughly 6-month increments, are we seeing movement? Have we seen improvement in some of the attributes? And I'm going back to the align dimension. And you can see on the left-hand side the current state baseline information on the primary question over here, and then the sub-questions. And then you can see 6 months down the road, there is some evidence of some movement and improvement. And then you can look again 12 months down the road and say, I can see some evidence of even improvement a little bit higher toward that ideal state. Now looking at all of these results, each of those little red dots is a respondent, the blue dots is the average number. That can be kind of challenging, and another way to look at the data is to summarize it this way and look at the averages to see where do we see the major movement? What are the key things that seem to be moving in the direction related to key behavior indicators? And where do we see some things that perhaps are not moving, both in terms of comparison to the ideal or moving closer or farther away? And this graph right here shows how that response on the simple, clear purpose seems to be making movement in an upward direction. Now there is a fifth element. We do have a survey or a dimension that asks questions about the systems for results, but we're also interested in getting actual results from the organizations that are doing this, because at the end of the day, we want to go back to that relationship between the do and the get to confirm that by working on those KBIs, by working on those systems, indeed the actual results are moving. Now here's what we've seen thus far. We have seen improved results using methods, but what we want to know is what leads to those sustained and continuously improving results. In many cases, we've seen where some initial improvements have taken place, but over time, things are eroded and they go back to the way that they were. And so we're trying to confirm the link between the KPIs and the KBIs. So in the work we do with the organizations, we're also asking them to provide us with the actual results. And they can be results from the overall organization movement related to quality, safety, cost, and so on. But they can also be in specific learning areas or model areas or improvement areas. And that's what we're interested in covering. And in subsequent webinars, as we continue to test this model, we're going to be taking a look at what does the data show related to the results. So we're very interested in that fifth element of the instrument as well. And again, we want to confirm that with confidence we can show that by working on those KBIs that we've seen anecdotally, and we can prove with research that it does actually show not only improvement in the KPIs, but sustained improvement over time. And we're interested in knowing what are the attributes or the characteristics of organization where that seems to take place. Now, there are some other ways that we've used this instrument. The primary way I've been showing you thus far is when we engage with an organization and they're trying to apply the model and use the model, and we want to see how that's working in roughly 6-month increments as they're working through that deployment plan. Some organizations have asked for an outside assessment, essentially a team of assessors coming in to give an outside view and to look at how they're doing. We've introduced this survey methodology as a supplement to that process so that we can get, the assessors can get some baseline data from the organization prior to the assessment, and then we use that to compare with what we see with the on-site behavior assessment to see, are we seeing the same things? Now here's an organization where they had asked us to take a look at, let's look at what we find from leaders, managers, and frontline, and let's also look at those in areas where we've devoted time to model cell work, or where we've not devoted time to model cell work. We wanted to see, can we see the difference? So at a leader level, and this goes, I've been talking about the alignment dimension. This is an example of the engagement or the enabling dimension. And if you can take a look at this, you can see there is some evidence that you see higher responses in those in the model cell areas. And that's a little encouraging as far as the evidence that they see in the organization. What's interesting to us is what do you see that's different when you look at from leaders, managers, and the front line related to this question? So here's the organization related to the managers on that same question. And you can see as you look at this, a lower level of respondents. Again, not everyone's looking at it through the same lens, but it's interesting. And you can also see there does seem to be some evidence of differences in variation and average values between managers that are overseeing model areas and managers that aren't overseeing the model cell areas. And then what's interesting is with the front line, one of the takeaways that we look at this is it takes a while for these systems and processes to show up as evidence at the front line. I'm going to back up a little bit and say, leaders have probably been working on this for a while and deliberately engaged with this. Managers yet to a certain extent, but how it shows up on the front line and the evidence to show differences between model areas and non-model areas is less clear, and tells me that it takes more time to have this show up in the systems and behaviors from the front line. So we found this to be interesting. We found it to be a good adjunct to add to a an assessment, real data from the organization provided by the organization to help understand the current state. Another example is just getting some basic information from an organization as we begin to work with them on one dimension. And so we pick alignment to begin with, and we say, where do we see leaders, baseline current information related to that alignment question, and where do we see managers? Just to start with, just as a beginning tool, and then over time, we would add the dimensions of enable and improve, and then results. But we've used this to help understand, do we see similarities? Do we see differences? And what does it say about the current state of the alignment systems in the organizations? Which helps us to then work with the organization, or helps the organization to understand what kind of experiments could they run to affect that overall question. It could be that maybe they need a simpler purpose statement in their organization that everyone can resonate with. It could be that there's communication systems that need to be put in place. And then also, what adjustments could they make in the systems that are affecting those sub-questions along the A and the B categories. And our advice is not to try to move everything at once, but pick the one or two that you want to try to move, and then re-administer the survey again in 6 months and see, have you seen some movement? And we've seen good luck with good results with this as organizations have tried to deliberately move those levers related to the results. I want to share a little bit about some of the lessons we've learned thus far. First of all, this can be a useful method to help to identify current state and identify the gaps. So it seems to have some utility. We see evidence of agreement between this and when we do the on-site behavior assessments. So for instance, if the assessors see that some of the major gaps might be in a problem-solving system, we've seen similar results with the pre-assessment survey that also confirmed this and confirmed what the assessor saw on site. It's pretty evident to us that this is not going to be a substitute for a behavioral assessment, but we think it can be a useful supplement, and it can also be something that an organization might use to say, so we've made some efforts to improve. How would we know we're making some progress? And if they've done some baseline assessments, they could use this to test to see, have they seen movement upward or downward, and that this could be done perhaps without the time or expense of having online assessors come on site, which might be beneficial for an organization. Some of the other things, as we've worked with organizations and reflected on this, it's pretty clear that some of the established systems in an organization will and do drive the negative behaviors for both key behavior indicators and key performance indicators. And these are pretty strong systems that are in place in many organizations. Some examples are performance evaluation systems that seem to focus almost exclusively on the individual without understanding the effects of systems. Recognition systems are strong systems that can reward results. So when people are asked what gets rewarded in an organization, it could be that results is what gets rewarded. And that can be a strong effect, can work against what the organization is trying to do if the focus is primarily on results. And also, reward systems can focus on and reward heroic efforts and workarounds, as opposed to the kinds of systems that the organization is trying to put in place related to alignment, enabling improvement. And then finally, we've seen productivity management systems that where people are trying to meet certain work standards in their department, which do not allow time for people to spend time improving the work. And so we've seen that those are strong systems that need to be addressed if the organization is going to make progress along this. Just to back up a little bit and illustrate what do I mean by that, and talk a little bit about some of these strong mental models. I want to go back to this see, do, get diagram and talk about how we see the world and the mental models. Learned a lot from a great book that I highly recommend to people that I talk with, written by Derek and Laura Cabrera, called Systems Thinking Made Simple. And one of the things they describe in the book is this reality that we don't directly interact with the world. We interact with the world through mental models. And this means in interactions we have with other people, with interactions we have throughout the organization. We take in information through our mental models. Our mental models are essentially approximations about how the world works. And when we make observations and we learn, we're essentially getting feedback on the mental models that we have. And so it's important to understand this point that we are viewing the world through our mental models, and some of these mental models are driving some of those existing systems that we've learned about and seen in our organizations. One of the mental models that needs to change is this strong view of the organization as a hierarchy. Now, at a future webinar, would like to have a conversation about it's not that shape of the hierarchy that is the problem. It's the problem of how we view that in sort of a vertical manner that is the problem. And so when we have mental models that view the organization as that vertical hierarchy, when we see the job of leaders as planning, commanding, and controlling from the executive suite, or when people view the organization as a set of parts that are managed separately, or I mentioned productivity before, or any outcome really, that's seen as the sum of the individual parts. Those are some of the mental models that we're going to have to challenge and understand the limitations of those mental models. I mentioned the focus on results. Some people do believe that if you want better results, you do it by focusing on results. And that's a mental model we're going to have to challenge and understand the limitations of that. And then finally, focus and action on the individual. So we're going to have to assess those models, and we're going to have to learn a little bit about different models. And one of the things that I like to think about is the model that Dr. Deming talked about as far as looking at the organization as a system and how we see the organization as a system. What's the job of leadership here? If it's not planning, commanding, and controlling, what is their new job? And we're learning that a lot of it is around alignment and coaching, and they need to spend time at the work site. They need to understand what's going on. They need to go to Gemba. They need to manage the organization as a system, not as a set of parts. and they need to see that the productivity or whatever outcome you're after is that not necessarily the sum of those individual parts. It's not the sum of the departments, but it's how those parts interact with each other. The challenging notion that you don't improve results by focusing on results. People need to realize that you do want to get better results, but how you get those results make all the difference in the world. And by thinking about and talking about the systems that are producing the results is where the emphasis and the focus needs to be. And then finally, our predilection to try to focus primarily on the individual needs to be challenged. And it isn't that the individual never is the focus, but we also have to balance that with understanding what are the systems that need to be understood. So I'm going to pause, and I'm going to see if there's any questions. I'm going to unmute the phones and see if we've got any questions from the group to see if they've got any questions on the topics we've talked about thus far. I have one chat question, but it's a request. Jennifer wants to be made the presenter, so I can do that.
No, I don't.
No.
Just kidding.
Oh, okay.
I hit the wrong button.
Oh, okay. All right. No worries. Are there questions on any of the topics that we've covered? The phones are unmuted, so anyone can ask a question. Anybody that's used the survey, anybody that's provided data that would like to provide any input, the utility that they found from it?
Mike, this is Mary Beth Germain. I was going to ask, how do we get the survey?
Well, that's what on this link here is. If you're interested, I could set you up and you could test it in your organization by doing it that way.
Okay, perfect.
Looks like an easy crowd today. All right.
Mike, it's Roger. I'm here with Nancy, Nancy Gurney.
Hello, Roger. Hello, Nancy.
Yeah. Well, you know, you've been training us, and we've been testing and applying. I guess I have multiple questions. That's why I have to unpackage them for myself. The first, and maybe it's a simple answer, but I appreciate that the test on the alignment piece is at a department level. And as we're beginning to go through some fairly significant changes and already have, you know, branding changes, strategic plan communication changes, vision changes, what's the idea to be able to aggregate that to get a system view of alignment instead of the, you know, to get the macro view versus the micro view?
Well, in some of the organizations where we've applied this, when we want to understand the current state, we'll do a assessment, as you know, in an organization and talk to as many people as possible. And we'll see what we get from, say, by department, there's going to be variability. And what we end up doing is say we see some strong systems in alignment in these departments, less so in these departments, and overall for the organization, if they're looking for some sort of an average number, we can do that. And we can also do that with this survey that said, you know, we applied this in say 6 different departments, and overall where we saw some similarities and differences, we have produced it at that high level to take a look at kind of like the sum of the systems or the macro view of the systems, represented it either in those charts that I showed you or some sort of an Excel style average. There could be good reasons why the variation is there, why some people don't see the same levels of alignment. Could be the deliberate work that has been done or hasn't been done, specifically some of the examples around what we've seen in model areas and non-model areas. So hopefully that helps. We've seen that, you know, when you take, let's say, the averages for various departments and try to aggregate as a whole, it might help the organization to understand current state. What do they do differently? They have to look at what are the systems that affect all of the departments and how they're trying to move all of those departments forward.
And maybe I missed the point, but this one is done live because we're looking, or you're asking the question. They're all face to face, or is some of this through a SurveyMonkey instrument?
Mm-hmm.
I'm just thinking about the size and scope of an organization like ours, 12,000 people, ambulatory, acute care, 30% roughly corporate functions, and how to get a true both the aggregate, but also to be able to understand by major functional area. We went through this whole schema design when we were building the database for our KaiNexus continuous improvement database product to really understand how to have that system designed. So as we begin to aggregate micro data, it would indeed roll up to some type of an accurate macro.
Mm-hmm. Well, that's essentially what we've been asked to do, some assessments on organizations to look at their current state. And so the approach that we're taking is we want to build this survey instrument into the assessment process so that when we go on site, we've already got some baseline data. And when we look at the survey data to begin with, where we're able to look at differences, say that they've got 10 different hospitals and they want to find out what's the current state at those 10 hospitals. Depending upon how we build the survey instrument, you can see how it looked for hospital A, B, C, and on through 10. And then you can understand the variability that you've got there.
What's the, roughly like sampling effort if you're looking at 10,000 employees, 10 hospitals, like you said, to, both in terms of the assessment team, time, scope, how much of that's manual versus automated?
Well, what we've learned is that if you want to get a current, again, you want to get a current state, it's going to require some on-site view. We have tested different ways to get random sampling, especially at the frontline area. So how many people from the front line would need to participate in a survey for us to be able to make some conclusions about the data that we get. We recently did that with an organization where they wanted to take a look at responses from leaders, which was 100% sample, or we asked 100%, managers, and then they were also 100%, and then the front line. And this was, in this organization, it was an organization with about 2,000 employees, approximately. So we didn't ask all 2,000 frontline to submit a survey. We picked a random sampling of people, and they also wanted to know the differences between model area and non-model area.
Right. Okay, that's helpful. Thanks.
Okay, so there's some questions that have come across on the chat function. One is from Doug. Are the survey results benchmarked? How widespread do you suggest the initial survey be? Well, in benchmarking, what we're doing is comparing the results we see with our experience, both in terms of organizations we've assessed with the actual face-to-face assessment, as well as experience with two of our partners have been with the Shingo organization for years and looking at that data related to what we're seeing as far as Shingo applicants, Shingo Shingo recipients, and so we're comparing that data as well. For the initial assessment, what I recommend is start small. Start with senior leadership and understand the current state there. If necessary, go to management and understand the current state there. I don't recommend going broadly across an organization. I recommend thinking in terms of small chunks, and then pick a dimension or two. Start with a line and then move to enable, then move to improve as you're trying to understand the current state, and then feed the data back to the organization as you get it so they can have discussions about what the data mean, as opposed to trying to produce one great big chunk or report related to this. Here's a question from Randall. Resource would you recommend to learn more about the concept of KBIs and identifying them for one's department? I think that some of that would be covered, and I'm going to go back to the slide on the white papers earlier. I want to go back to this slide. So in the white papers, there's one on alignment, one on enabling, one on improvement. We have examples of once you understand the principles, what would the ideal behaviors be for that? Now, we have done some work with organizations that wanted to develop KBIs based on their understanding of principles. And that could be a subject of a future webinar where we could talk about how organizations have gone about that. Some have tried to link it to existing values, which we find to be pretty strong. And it helps people understand the relationship between values and principles. So I'd recommend those white papers as a beginning point. Any other questions? Okay, I want to go to some of the closing slides and just talk a little bit about some of the future things that we're going to be doing. So you'll see this webinar. If you go to our website, this is going to move over to the webinar recordings. Here's a recording from last month where Dan talked about emotional contagion. And then you'll be able to see what are the upcoming webinars you're going to see. Everyone that participated in today's webinar is going to get a copy of the link, but it's also going to go out to the distribution list as well. So in September 30th, Didier Rubino is going to share some of his thoughts on strategy deployment. And so that's going to be a very interesting viewpoint. You can see Didier there with Catherine Correa at Health East, and Didier has volunteered to share some of his current thoughts on strategy deployment. One of the things that our team is working on is the idea of a white paper that, for lack of a better term, we've titled it The Pracademic's Guide to Strategy Deployment. And so we're interested in working with a number of organizations that have thoughts on the important topic of strategy deployment, what works, what doesn't, lessons learned, things like that. So watch for that for the future. In October, Dirk Van Rossum from NCH Healthcare in Naples, Florida. Dirk had some questions about case studies or exercises that can help primarily leaders understand to think systemically, and how do you do that. And Dirk is very interested in knowing if others have prepared any case studies or exercises to work with leaders on that. And so I've provided his email address there if you've got any suggestions or examples, or you would like to co-present with Dirk at the October 21st webinar. That'd be great. In November, this is interesting. So Rafael Rojas from Providence Health Services shared a copy of his doctoral thesis with me, which included some concept of mindfulness in the lean journey. And I thought this was really interesting. And so he's agreed to provide a webinar in November, Friday, November 11th. And you can, if you want to learn more, you can go to that bit.ly link below on that topic. And then in December, Sarah Grove from Winneshiek Medical Center in Decorah has agreed to share some information about how she's learning and applying some of the concepts in the rehabilitation medicine department. And I'll be talking with Sarah about the format for that. They've really got some great things going on. Very willing to share what they've learned thus far. And that's the whole idea behind these monthly webinars, is for people to share and learn with each other about how this works. It may be that those on the webinar today have got a topic they would like to share. Some of you I've talked about. I've got a couple other ideas in the works, not yet dedicated to actual meeting dates, for people to share some of their current thinking and work on things. But if you do have any stories you'd like to share, or ideas or questions you have about how this is working in other organizations, please just send me an email and let me know. And also, we have a group on LinkedIn if you want to join that, if you use LinkedIn as one of your social media platforms, you can join that group, and we're going to be continuing to share questions and answers that way. So I'll pause one more time to see if there's any questions, comments, debate. Okay. So it's Friday afternoon. I hope everyone has a good rest of the day. Hope you have a good weekend. If you're traveling, travel safe. You'll be getting a link to this webinar recording shortly. So thanks again for your time today.
Thanks, Mike. Have a good weekend.
Bye-bye.